Hello and welcome to today's lecture on dilated cardiomyopathy. Like the video and subscribe to the channel so that you don't miss any future videos. Today we're trying a new format with less text and more voiceover. Please let us know if you prefer this style or the previous style. Let's begin. Introduction. Dilated cardiomyopathy is characterized by an enlarged left ventricle with reduced systolic function. Mitral regurgitation commonly develops as a valve ring gets dilated along with the ventricle. It's interesting to note that almost half of all patients with new-onset cardiomyopathy demonstrate substantial spontaneous recovery. Even with long-standing disease, some patients have dramatic improvement to near-normal ejection fractions after treatment with beta blockers combined with renin-angiotensin system inhibition. So don't give up on a patient just because he or she has dilated cardiomyopathy. For patients in whom left bundle branch block precedes clinical heart failure by many years, cardiac resynchronization pacing or CRT improve ejection fraction and decrease ventricular size. Again, remember that there are options to treat such patients. In this lecture we will look at the different causes of dilated cardiomyopathy. In subsequent lectures we will deal with them in groups, in more detail. The groups are inflammatory, toxic, metabolic, familial, idiopathic and miscellaneous. The first group consists of inflammatory myocarditis. Inflammatory myocarditis can lead to dilated cardiomyopathy in the long run. Inflammatory myocarditis can be caused by infections and non-infectious causes. To remember the infections, a good process would be to remember the different classes of microbes. Among bacteria, there is diphtheria. This is an effect of the diphtheria toxin. This is why we give diphtheria antitoxin as part of treatment. This is also why we vaccinate kids with the DPT vaccine. Also remember that diphtheria toxin can cause neuropathy. The other bacteria is the spirochete, Borrelia, which causes Lyme disease. This is not seen in India. Important parasites are Trypanosome cruzi, which causes Chagas disease. Viral myocarditis is caused by HIV, hepatitis C, adenovirus and Coxsackie virus. Rickettsial Q fever and systemic fungal infections can also cause dilated cardiomyopathy. Non-infective causes for inflammatory myocarditis are granulomatous diseases like sarcoid and giant cell myocarditis. Remember that sarcoid is like tuberculosis and can affect any part of the body. There can be myocarditis as part of the inflammatory myocarditis like polymyositis and dermatomyositis. After all, the heart is a muscle. If a heart is transplanted and it gets rejected, there can be dilated cardiomyopathy. An important drug that is used commonly in oncology that causes dilated cardiomyopathy are checkpoint inhibitors. Please note this for competitive exams. Among toxic causes of dilated cardiomyopathy, the most common toxin, so to speak, will be alcohol. Alcohol-induced cardiomyopathy is characteristically a dilated cardiomyopathy. Drugs of abuse like amphetamines and cocaine can also cause this. There are also certain other chemotherapeutic agents that can cause dilated cardiomyopathy. One is trastuzumab, which is used for the treatment of breast cancer. So it is important to do an echo for any patient before starting this drug. The effect is dope-dependent and therefore, most of the screening protocols will include regular echo screening in the protocol for breast cancer management. The other drugs are anthracyclines. Interferons are used for the treatment of multiple sclerosis, hepatitis B and C, etc. They can cause dilated cardiomyopathy. Hydroxychloroquine and chloroquine, which are antimalarials and drugs used in rheumatology, can cause dilated cardiomyopathy. Anabolic steroids used by all, yes, I said all, bodybuilders can cause dilated cardiomyopathy. No matter how many times you go to the gym, you cannot create abnormally large muscles without using steroids. This leads to their widespread misuse. But they have a number of side effects, one of which is this. Bottom line is, don't take steroids. DCM can also be caused by heavy metals like lead and mercury and hydrocarbons and arsenicals in high amounts. Next, let's talk about metabolic causes. This includes nutritional deficiencies like thiamine, selenium and carnitine. Remember learning that thiamine deficiency causes wet beriberi? Well, wet beriberi is actually heart failure due to dilated cardiomyopathy. The word wet refers to fluid retention in heart failure. Selenium deficiency is called Keshan disease. Electrolyte abnormalities like calcium, phosphate and magnesium deficiency are also causes. So are endocrine causes like thyroid disease, pheochromocytoma and diabetes mellitus. Note that diabetes causes a cardiomyopathy with a mechanism different than that due to coronary artery disease. Same with obesity. It is also important to note that hemochromatosis can rarely cause a dilated cardiomyopathy. But, Most commonly it is a restrictive cardiomyopathy. Moving on to inherited causes. Muscular dystrophies are diseases due to defects in certain muscle proteins. Dystrophin-related diseases such as Duchenne or Becker's can cause DCM. Mitochondrial myopathies are also causes. Moving on to some rare causes. Peripartum cardiomyopathy is a condition that is seen, as the name suggests, during the peripartum period. It is a reversible condition that is related to a prolactin fragment that is transcribed at this time period. Left ventricular non-compaction is a relatively rare condition that is increasingly being recognized. Long-standing tachycardia due to undiagnosed or untreated arrhythmia can lead to dilated cardiomyopathy. That's all for today's lecture. More will follow in the days to come. Kindly let us know in the comments whether you prefer this format or the previous one. Have a nice day.